Okay, could you please confirm to me that you are able to see the screen before we start? Anyone inbox me, please? Okay, thank you. So here is how to explain a procedure or a new treatment. There are some steps you can do, okay? So first of all, when your task is to explain a certain procedure or a certain treatment, there is a difference between obtaining a consent, explaining the procedure and obtaining a consent, and between just explaining the procedure. If you were not asked to obtain a consent from the patient, then you don't say that, would you like to sign the consent form or and so. No, just explain the procedure as a part, like the task says, okay? If you are asked to sign the consent, obtain an informed consent, then ask them to sign the consent form. I'll show you in the consent lecture how to obtain an informed consent, what you need to do. But for now, you will just explain the procedure without consenting as the task says so, okay? So when you explain a new treatment or a new procedure, you start with reminding the patient with the negative effects the disease having on his health. Make them remembering the suffering, make them realize how bad their situation is, that they are not responding to treatment, okay? Which the disease, so remind them with the negative effects which the disease have on their life. Show empathy and that you are here to help them, okay? Ask them about previous episodes of their diseases, previous relapses, the hospital admissions, okay? And their bad effect, hospital admissions, complications of the disease, side effects of drugs, job issues, that they needed to leave their job because of their disease. Okay, they're suffering, they are taking medications, they're complying with their medications, but with no benefit. Then say what the best treatment or the best procedure is, and use a promising tone of voice when you do that. Why? Because you're bringing them a solution. Okay, whenever you have a new treatment or a new procedure to offer to the patient to make him better, to feel better, that's good news. So you do it with a promising tone of voice, not with a sad voice like when you break bad news. Reassure the patient. Tell them they are not the only one in the world who will be doing this procedure or this new treatment. Okay, it depends, of course, it depends on the procedure. Like, for example, if it was a palliative procedure, then you won't represent it as the ultimate solution and best curable option, or it depends on the scenario. Some procedures are actually curative. Some treatments, when you start them, they are actually very good. Others are just palliative. So pay attention to your tone of voice and your body language when you do that. Like, for example, when you explain the procedure of ERCP, it's not like when you explain ERCP for the terminal stage cancer, or when you explain the procedure of a Hickman line to give chemotherapy. Okay, it depends on the situation. It's not like when you explain a procedure, like, for example, a valve surgery, a valve replacement surgery. Valve replacement surgery is good news. There is a solution for the patient. It's not bad news, okay? So you can do it, that, say, represent it as being one of the treatment modalities in active treatments in the patient's condition. So start with reminding them how bad their condition is, okay? And then say what the best treatment, your proposed treatment is, or your proposed procedure is. Reassure the patient because you're bringing them a solution. Tell them they are not the only one in the world who will be doing this procedure or who will be started on this treatment. It could be steroids, it could be insulin, it could be disease-modifying agents, it could be biological agents, it could be anything. Address their concerns and respond to them one by one. If they have any fears, if they have any concerns, solve them, explain to them, answer the questions. Don't forget checkpoints. Does that make sense to you? Are you okay with that? And so on. Like Dr. Barakat, he was checking the checkpoints frequently, and that was a good point. Okay? So check understanding as you go. Show empathy. Ask questions and concerns. Okay, you have to do that every now and then during the discussion. Then don't forget to provide written information, pamphlets and leaflets and websites. Draw diagrams when you explain to the patient. That may be useful. Remember to explain fully, in simple terms. Avoid medical jargon. Don't say stoma. Don't say colectomy. Don't say exacerbation. All right, use simple layman terms. Encourage the patient to meet people who did the same. If they are still refusing to start this treatment, encourage them to meet people who did the same procedure or treatment. Okay? Encourage them to read about that. Tell them that you can arrange for a meeting with people who did the same procedure before. You can hear from their own experience how their opinion is about this procedure, how they were before it and how they became after it. Would you like me to arrange such a meeting for you? Okay? Encourage them to read about this procedure. Okay, arrange a meeting with the doctor or the surgeon. They are still not let's say they are still refusing to do this procedure or take this treatment, then arrange a meeting with the doctor or surgeon who will do the procedure himself if they are still not sure. If they still refuse, suggest a second opinion. All right? Tell them what complications may happen if they don't do it. So you'll explain the procedure. You explain what it is, how the operation is going to be done, or how the medication is given. Okay, is it given through tablets, or is it given IV or whatever? Okay, and then explain the indication for this treatment, explain the possible side effects or complications. Okay, but under a follow-up or with our team or the team of doctors, you will be very well taken care of, and these side effects can be controlled. Okay. Tell them either if they agree to do the procedure or take the treatment or not. Tell them what will happen if they don't do it, okay, or if they don't take the treatment, and how they will improve if they did it. Explain adverse effects which may be associated. All right. However, at the end, if you did all your efforts and they still refuse, you have to respect their autonomy. Okay. So this is the block for explaining a procedure and the key steps. So interview structure, start with greeting the patient, confirming the ID, introduce yourself and your role, establish rapport, set the agenda, assess understanding and the eyes. Do your task. Remind them what the negative effects the illness has on their life. Explain what the best management is with a promising tone of voice. Explain the procedure or new treatment. Use drawings if possible, indication, benefits, and complications. Reassure they are not alone and not the only patient who will do this procedure. There are many people who did the same procedure before. So what do you think about that? Do you have what's your opinion regarding what I just explained to you? And then assess their opinion about it. If they are still unsure, encourage them to meet other patients who did the same procedure or treatment before. Tell them that you can arrange for a meeting. If still refusing, advise meeting the doctor who will do the procedure. If still refusing, suggest a second opinion to meet your consultant, for example. Explain the complications if they don't do it, the procedure or the proposed treatment, what's going to happen. Okay, and then assess their that would be your management plan. Okay, then you assess the ideas, concerns, and expectations. Effect on life. How would this information you just tell them affect their life and provide support? Summarize with the suggested plan, and the end, the consultation. Okay, this is the interview structure. So whenever we go, if your scenario For example, you see what applies to your given scenario and follow it. This is because this is the outline, this is the key steps. I'm just providing these blocks just to remind you to stick to the interview structure so that you have a solid frame to follow in the exam. Because under the stress of the examination, under the stress of the exam is stressful. So if you didn't practice a lot and if you didn't have a solid plan to follow, you will forget things. That's why I'm repeating this block and including this interview structure every time. So this is the scenario. I'll see who's interested to practice. Okay, Dr. Mohammed Farouk, you can unmute yourself. Dr. Mohammed Farouk. Okay, you can speak now, Dr. Mohammed. Yes. I can hear you. Can you hear me?
Yeah.
Okay, so this is your scenario. I'll give you 5 minutes to read it, and then we will start, okay?
Okay.
All right.
Hello.
Yes. Are you ready?
Yes, can we start?
Yes, sure.
Good morning.
Good morning, doctor.
Uh, may I know your name and the age, please?
Yeah. Uh, I'm Sarah Motson. I'm 19 years old.
Sarah Morrison.
Yeah.
Okay, can I call you as a Morrison, Miss Morrison? Is okay?
Yes, it's okay. Yeah, it's okay.
Okay, Miss Morrison, I am Dr. Farooq. I am one of the doctor in the gut clinic. How are you?
I'm fine. Actually, I'm not, doctor. I feel sick.
Mhm.
Yeah.
Okay, Miss Morrison, we are here to discuss about your health issue. Is it okay?
Yeah, it's okay.
Okay. Before we start, can you tell me that what do you know about your health issue? Anybody explain to you something or
Well, yeah, I know. I have a disease which is called ulcerative colitis. I have a
okay?
problem. I have a problem. It's like a kind of some kind of bleeding from my colon.
I'm
Um,
sorry to hear that.
Thank you. And it's have been so bad, not responding to whatever medications the doctors are trying with me.
I'm really sorry to hear that.
Thank you.
You are being suffering for this, right?
Yeah, I mean, you can't imagine how this have affected me and my life lately. Been so bad.
So it's affecting your daily life and the job.
Yes, sure. Everything changed. I've been busy with this disease from spending my time in the hospitals, spending most of my time in the follow-up clinics. And
Mhm.
I mean, I had to leave many things in my life, just um, try to find some time for my disease.
I'm really sorry to hear about it, and we will
Thank,
help you in this regard.
thank you.
May I know what the job you are doing?
Well, I'm still a student.
Okay, so it's affecting your studies. Am I
Yeah,
right?
yes.
Okay, and it's affecting your family life as well.
Yeah, I mean, I don't have, I stopped spending my time on entertainment stuff like I used to do before the disease. And
Okay,
yeah,
what hobbies you are having?
well, I used to work out. I play sports sometimes, but I can't do that
Okay,
anymore as before.
really sorry to hear about it.
Thank you.
Okay, so do you know that the disease ulcerative colitis, what is this and what the problem with this disease? Or you want me to explain more about it?
Well, as far as I know, it's a problem in my gut, specifically my colon. As the doctor said, I have a problem
Yeah,
with my colon. Yeah, and it's causing some bleeding and having this passing this bloody stool from my back passage frequently. And yeah, that's all I know about it, or as far as I remember about it.
yes, you are right that this is the problem in the colon, and this is causing the bleeding and passing the stool with blood, and you may be facing the tummy pain. Am I right?
Yeah.
Okay, I'm sorry for that. And sometimes the people have some other symptoms also, like they have the joint pain, they have the red eyes, and they have the sometime yellow discoloration of the eyes or some liver problem. Are you getting what I'm saying?
Mm,
So this disease is having so
yes, I
many
understand.
problems. You understand what I mean?
Yes, I understand.
And you tried many medication for this one, including the recent medication which is available, very effective for patients, but it was not effective for you. Am I right?
Yes.
Okay, so the good thing is that we can do something for you, uh, just to prevent the complication of this disease.
Like what?
That your case has been discussed with the surgeon, and he planned that he will do surgery for your gut, and that will just relieve your symptoms and the problems what you're facing day by day. You want me
What
to
kind of?
explain the surgery?
Yes, please.
Yeah, as he saw your case in detail, so he planned that he will remove the colon. Okay, you know the
Yes.
colon is the last part of the gut, and we are passing stool after that from the back passage.
Yeah.
So just I will draw for you. This is the gut. Okay, this is the small gut, and this is the large gut. Large gut is part is colon. This colon is having the problem with you and having this bleeding and all the symptoms. So the plan is that to remove this colon and this small part of the gut, the small gut will be connected to the back passage. Uh, the thing is that it cannot be done immediately. We can remove the colon, and it will take time to just reconnect this small gut to the back passage. And during this period of time, we just connect this small gut to the skin on the right side of the tummy.
What do you mean,
So I mean to say that the same as a back passage, there is we make the artificial passage on the lower right side of the tummy to just pass the stool from that, and just we put some bag over there. We technically call it colostomy procedure, and we put the colostomy bag for this. Don't bother yourself with this name, but we put the bag to collect this stool from this part.
So you mean, doctor, that I'm going to poo in a bag? Is that what you're
Actually,
trying to tell
this
me?
is for yes. Actually, this is right, but this is for a few months. Will This is a few months time to be given to the gut, and then this part of the gut which is connected to the skin will be connected to the back passage. So then you will pass normal stool as you were passing before. So this procedure initially will be done, and its initial part will be done, and it's only the temporary for few months. Are you getting the point?
No way. I'm not going to do this. I'm not going to poo in a plastic bag. No way, doctor. This is not going to happen. Sorry.
Okay, I can understand that how this news for you, and it's actually that this procedure has been done for many patients, and they are comfortable with this, and I can arrange the meeting with them, and you will see that how they cope with the life with this one. The bag will be not visible because it will be under the cloth. Uh, so that bag can be easily changed, and we will give the full training to you that how to just clean this area and how to change this one. And we have our a team expert in this one, so they will explain that how these things can be done, and you will not feel any problem with that.
No, it's going to show. People will see that I have a bag. I don't know. I mean, I can't imagine how this is gonna happen. The hygiene and the smell and the appearance
uh,
of the bag. No way, doctor. I mean, this is so difficult.
the thing is that it will not be visible to the people. It will be under the cloth, and it will be covered, and there will be no smell because the bag is fully sealed, and we will tell you how to just clean this one, and everything will go fine with this. Initially it will be difficult, but by the training, by the understanding, this will be okay. And just to understand that this is the temporary procedure, Then there another procedure will be done to just connect this part of the small gut to the back passage, and that everything will be all right. You got my point?
Yeah, but there are I have so many questions about this. I mean, I can't imagine how.
Yes, please. I'm here to answer you, please.
Well, one of the questions is that I'm a swimmer, doctor. Okay?
Yes.
How am I going to swim with that bag?
Uh, this is your concern is right. I appreciate your concern. Maybe for some time you may not do this swimming because this part is with the bag and it will be difficult. I'm sorry to say that it will be difficult for the swimming, but some special swimming costume may be available. I will check for it that is available to just protect this thing, and it can be easy. I will just see that how the other people are coping with this one, with the swimming, with the daily activity, with the exercise, and I will let you know everything.
Okay. And, alright.
So the thing is that you know why we are doing this procedure, because you are suffering a lot and you are not responding to the medication. Are you getting the point?
Yes.
So if you will keep it like this, it will have the more problems, it will more bleed, and it will have the more complication. And sometime it can be the serious complication,
Yeah.
like it can turn to the cancer. So that's the thing we don't want for you. So this is the best thing can be done for you. I know this will be suffering for few months till this bag will be there, but you will understand it how to cope up with this, and we can explain to you everything. We answer for all of your questions, and we will just arrange the meeting with the people who have did this procedure. This is a usual procedure done in our hospital. Many patients did this one, and they are doing the going having the comfortable life, coping with this. And this is not a permanent, as I may have to mention.
Well, I don't
So
know.
you have any other concern, please?
Yeah, I mean, what's gonna happen during my intimate time with my husband with that bag? It's embarrassing.
This I think that for we explain to your husband as well, and this will not have any problem with that, because it will not be leaking or any smell or anything. So, and we will explain to your husband that how necessary this procedure is for you, and I think he will understand, and we will help you in this regard, that to just let him know and explain everything.
Okay, I'll see. I'll think about it. I'll see.
Do you have any other concern?
No,
Okay, so to whom you are living with at home?
I live with my husband.
Okay, you have any kids?
Not yet.
Okay, so uh, are you still in the medication?
Yeah, the doctors have tried medications with me, but nothing is working.
Yes, that's the reason we are going for this procedure. And after this procedure, you will be
Okay.
off the medication. This medication may have the problem.
You have 2 minutes left.
Yes, Miss
Two
Morrison,
minutes left.
Miss Morrison, this medicine may have the problem with the pregnancy. So that's good that you will be off the medication after this procedure. Are you getting the benefit of this
Okay.
this surgery?
Yes.
Okay. Do you have any other concern?
No.
Okay, so today we discuss about that you have the disease ulcerative colitis and you are not responding with medication, including the new medication, which are very effective for some people. And that's the reason that our surgeon decided to go for the removal of the colon, and he will do the some opening, which will be for temporary in the right side of the tummy. And after some months, we do the another procedure to just reconnect this part of the opening to the back passage.
Okay.
Okay, so uh, you understand, or you want me to explain more about it?
No, I understood.
Okay, so what we got from this consultation?
That there is a solution which is better from my condition, which is to
Yeah,
go for surgery, and that you
yeah.
will remove the part, my colon, which is causing the
Okay,
disease, and that I will have to have this opening in my tummy, in sorry,
okay.
in the belly, and that you will help me out how to take care of it. And however, doctor, I will think about it. Okay, I can't decide yet. I need to discuss this with my husband first.
Yeah, I think better you bring your husband. I will arrange the meeting with my consultant and the surgeon, and we can sit together and we can discuss more about it. And meanwhile, we'll tell you how the surgery will be done. The surgeon will explain to you that it will be not having any complications or anything. Some complications are usually happen with the surgery, but he will explain, and he's the expert one. He will explain more about this one, that what are the benefits or the side effects of this procedure.
Okay.
Is it okay?
Yes.
Okay, so
Time
Miss
out, doctor.
Morrison, so I will, Miss Morrison, I will arrange the appointment and we'll meet together, inshallah. Okay, thank you very much.
Okay, welcome. Thank you. So, what are the ethical issues in this scenario? Ethical principles?
The first of all, autonomy.
Yeah.
That's the patient has right to know that all the details about what's going on, and right to know what is the best management for her disease.
Mm-hmm.
And another one is the beneficence, that the best treatment for her when she's not responding to the medication is the surgery, to just remove the part, because which may go for the complication and may develop sometime in long run as a cancer. So to remove that part for the best interest of her, and avoiding the harm to try again another treatment which may be not effective. So we're just preventing the side effects of the medicine. So maleficence is the third one.
Okay. So, respecting autonomy, beneficence, and non-maleficence, you mean?
Non-maleficence, yes, non-maleficence.
All right. Um, okay. You did very well. Thank you very much.
Thank you, ma'am.
Welcome. Just, I felt that you were a little bit surprised with her concerns and how to solve them, right? She was asking,
Regarding swimming only, yes, I
yes,
was just thinking that what to answer.
yes. However, the people who have colostomy bags, they can swim with their bags.
Okay,
Okay, no contradiction. It's okay. No problem.
okay,
But if she is against the appearance, maybe she has a problem with having that bag and people are able to see it. Maybe she wants to cover it. Okay, so here
yeah,
suggest to wear, for example, tell her that there is no contradiction to swim with this with the bag. There is no problem. You can swim. But if she says that
okay,
my swimming suit will make it show to other people, and it's embarrassing, for example, so you can suggest to
yeah,
wear a snorkeling suit, you know, the whole fitting black
yeah,
snorkeling. So suggest that it
okay,
will cover. Okay, that's for
yeah,
as an example. The other issue
okay,
regarding during her intimate time, tell her that, as you said, it's tight fitting bag. There are some tight fitting bags available just for this purpose. Okay, to solve this concern of such patients. So you can give her
okay,
the advice and the contacts where she can find these bags, okay? Regarding taking
Okay.
care of the bag, cleaning, and so you did that very well. You told her that we have an expert nurse. She will teach you how to take care of it and clean it and so on. You will get used to it. All right, you did it very well. One of the things when you start to, first of all, you started to ask about her disease and how it's affecting her life. You did it very well. Then you go on by when you approach the issue and you want to tell her what your proposed procedure is, tell her that according to the medical researches and according to the studies, okay, there is a very good solution for your condition which will make you better. It's a solution. Colectomy is curative in ulcerative colitis, right? Especially if it is total or full colectomy, because you will remove the diseased
Mm,
part. So even the extraintestinal manifestations will get better, okay? So like, for example, take a look
yeah.
at this scenario here, okay? You are the
Okay.
medical doctor. Please read the summary and proceed further with the consultation. Can you see the slide now?
Yeah.
Okay, I want you to compare between the previous scenario and this scenario. This is Jasmine Kopta, a 49-year-old woman. She has had ulcerative colitis for more than 10 years, during which she had multiple exacerbations, of which she received numerous